Sean Shelley is a policy and human rights manager for TB HIV Care and is here to explain to us why there is a need in South Africa for a greater awareness around inclusive drug approaches to reduce the transmission of HIV in communities. Sean, thank you very much for joining us this morning. A very interesting topic and a very controversial one too. Two different schools of thought. First of all, there was an arrest recently in Tshwane where they were introducing sterile needles and so on, and so there's obviously miscommunication, a bit of a stigma. Please explain to us what happened there.
Yeah, so what happened there was exactly as you say. It was a miscommunication, and interestingly enough, they weren't arrested for the needles, which is what we'd expect actually. They were arrested for sterile water. Now you can buy sterile water for your car battery, you know, effectively distilled water. But as soon as it's packaged and labeled as a medical product, it becomes a Schedule 1 medication. And if you're distributing it and the person is intending to use it to administer illegal drugs, strictly speaking, there is a grey area in the law, and it's illegal. And that's what a particular police officer was acting on. He then confirmed with people from the Medicines Control Council that this was in fact the case. And despite a lot of interventions, and I must say we got a lot of support on this, from very high-ranking officers, from a cluster commander, a station commander, despite a memorandum of understanding, he decided that he was going to arrest these people. And I think he probably had a personal issue with it, which I'm not unsympathetic to. I can understand that when we've lived in a world where we see the sort of language around drug use, and we see drugs blamed for a lot in our communities. We think that the best way to approach this is to stop it, and he felt we were contributing to it. So I do understand it, but we did get a lot of support, and eventually at 1:30 in the morning, the senior public prosecutor from Pretoria came down to the police station, and the three people who were arrested were released, who had been arrested, they were released on 1,000 rands bail each, and the charges were dropped the following day. So it had a good outcome. And we were able to see exactly the level of support that we did get, which was good.
So, I mean, as you mentioned, you know, these programs are supported by Department of Health and other agencies. But why is this? We'll just explain the issue with programs like this, and I guess maybe the ignorance and the stigmas that are around what they might be perceived as enabling drug use.
Yes. So I'm not unsympathetic, as I've said. The stigma really comes around when you start handing out needles and syringes to people. People say, hang on a second, isn't that encouraging people to inject? And the data tells us it doesn't. There's robust data around it. There's been data for decades around these kind of issues. What we do know is that handing out needles and syringes that are sterile, first of all, prevent abscesses on the sort of one level, but then they also stop the spread of infections because people aren't sharing needles. And we didn't just come and decide to do this. What we did was we did an analysis beforehand. There was quite a robust study that was done, and we identified that people were sharing needles, that they struggled to get hold of sterile needles, that people weren't selling them to them, and if they were charging quite high prices for them. There were some sympathetic pharmacists, but the majority of people said, we don't want drug users in our community, we're not going to support them in any way whatsoever, and so they excluded them from the process. Now, we know that people who inject insulin because of their diabetes, there isn't an HIV epidemic amongst them, but as you said previously, international studies have shown people are 28 times more likely to get HIV through injecting drug use because there isn't an availability of sterile injecting equipment. So what we found is that people don't increase their injecting at all. You must remember there's quite a big jump between smoking or sniffing a particular drug and injecting. And I think part of the reaction against injecting is because one doesn't imagine it as a particularly pleasant thing to do to have to stick a needle in your arm. So that's where we are. And I understand the criticisms of it. But I think that our project speaks for itself. In our midterm evaluation of the project, which was done independently, we saw people's lives improving. We've seen areas where people have been very opposed to the project. We've seen people change their attitudes towards it because they see the benefits. They see people improving and getting better. And in Tshwane, for example, every single one of our staff members on the project was at one time a beneficiary of the project. And I think that speaks volumes for it, that people are able to change their lives just by giving them some access to services which they never had access to before.